Have you ever felt completely uncertain if the choice you're making for your child is the right choice? Have you ever yelled at your child, lost your cool, vowed you'd never do so again, and then found yourself doing it again a few days or weeks later? If so, I want you to know we have all been there. Every parent has been there. When we become parents, it causes us to be under immense pressure. We feel that pressure because we care. It doesn't have to harm us. Pressure can be good. It can be motivating. After all, pressure makes diamonds. Welcome to the Parent Doctor podcast. I'm Dr. Marissa Caudill, an adult and child psychiatrist, wife, and mother of two. If you're here, I'm going to guess that you're like me. You want to be the best possible parent for your children. You don't want to settle for just being a good enough parent. Maybe you're like me and that you're determined to be a cycle breaker within your own family. Here at the Parent Doctor podcast, I blend neuroscience, psychology, and spirituality to give you the tools to confidently grow as a parent. Because it's not just about raising our kids. It's about reflecting, evolving, and becoming the firm but loving parents that our kids need to thrive. I believe in the power of intentional, mindful parenting to help our children see our lives as examples of a life worth living. That might mean making some tough decisions in your life about your relationships, your work, your friendships, your habits. Can that be hard? Yeah, sure. But anything really worth doing is not easy. And that is how we're going to reverse the teen mental health crisis our kids are facing. By leading with love, embracing failure, modeling resilience, and creating homes filled with understanding and connection. So whether you're a seasoned parent or just starting this incredible adventure, you are in the right place. If you find value here, I'd be so grateful if you could follow, rate, and share this podcast. It's a simple way to help more parents discover the support they need on their parenting journey. Thank you for joining me. Let's get started. All right, well, welcome everyone. I'm here with Dr. Shivana Naidoo, another child psychiatrist. I think we're going to have a great conversation today. As I mentioned, this is about the book Bad Therapy by author Abigail Schreier. And let me introduce Dr. Naidoo briefly. Oh, awesome. You have the actual hard copy. I love it. I read it on my phone, so it's not the same. So she is a double board certified adult and child psychiatrist, just like I am. She works at the Bradley Reach Virtual PhD program and is a clinical instructor at Brown University. She's also the creator and host of the podcast, Thinking It Through with Dr. Naidoo. And this is a podcast that aims to build a greater awareness of the current state of mental health care in America, share insights to help parents and patients to find their own version of the best mental health care, and to help patients think through the tough questions that arise along the journey to mental wellness. She's the founder of Do Better MD, her private practice and consulting firm, and is licensed in many states. So you can reach out to her at dobettermd.com if you would like to talk to her about any specific questions with regard to yourself or your kids. All right, so without further ado, here is Dr. Naidoo.
Hi, thanks for having me, Dr. Caudill. I really appreciate being on your podcast.
So fun. I hope you share this podcast on your podcast, or I can come on your podcast. I've been on your podcast before, but I love chatting.
Yeah, Dr. Caudill was on my podcast in the very big, like midway last year in June. She has a podcast that was out there. So definitely take a listen.
Yeah, awesome. Well, so, all right, we were just chatting before we started recording today about the way this book made us feel a little bit defensive in some ways. And so I was telling her, for me, the things that made me most, maybe the things that I liked least about it are, first of all, the title, Bad Therapy. It's a bit controversial and it's very blaming, right? So she's taking this somewhat controversial stance to hold mental health providers accountable for the declining mental health of our kids, which I don't feel that's very helpful for sure, because anytime we blame, we're kind of giving away our power to do something about it. You know, we're just complaining. And that's ultimately something that can bring us together and make us feel good and have camaraderie with other people who feel the same way. But it doesn't do anything to solve the problem. Mm-hmm. And then the other issue I had was that she was critical of mental health providers not doing more to step up and advocate for kids during the crisis, during the COVID-19 lockdown. And I feel like that was something that we all were on the front lines with that. I was working at Kaiser Permanente here in Southern California. California was totally on lockdown. It was variable by state. You know, at the time that we hadn't gone to school in months, I was seeing friends whose kids were like going to baseball games without masks and like just kind of enjoying life as usual. So I know that there were places where it wasn't so bad. But ultimately, to criticize mental health professionals who were on the front lines caring for those kids in crisis during the lockdown, while we were simultaneously seeing their parents get sick in the hospital and taking all those precautions and seeing some of their parents even die. It was really, I think, an unfair critique, or at least it felt that way to me. I think it felt, felt like if we were to be critical of firefighters here in California when they're trying to put out fires, because they didn't simultaneously lobby the state government to do more to prevent the drought. It's like you can't be very active on the front lines and also be a lobbyist. Like, it's hard to do both things at once.
Mm-hmm. And for me, I came to the attention of this book by actually watching Bill Maher. So my husband and I watch Bill Maher every Friday when it comes out, and she was a guest, Abigail Schreier, who wrote this book. So that's how I became aware of the book. And then I became aware that she was kind of running the podcast, famous podcast, and I heard her on, I think, one of the Rogans. And it was interesting because when I was a resident at SUNY Downstate in Brooklyn, we had a journal club year that was dedicated to reading this book, The Anatomy of an Epidemic, which was written by the author of Mad in America, which is essentially criticizing psychiatry. And then as residents, we were all like, why are we reading this book? This is not relevant. And the people that ran Journal Club says it's so relevant to read the opposing side, right? We live in a time now where we're living in silos. There are two red and blue sides. It's important to know the other side so that we can address the concerns that come up. So I wanted to read this book so that I can understand what was she saying, because every time she's speaking to an audience of millions of people, she is sharing a perspective of this book and bad therapy. So she is shaping the lens of mental health care for youth. And I think she's not the only person doing that, but I wanted to hear what she had to say because of that. Like, what are the lay people, what are people, everyday people going to know about it? And then also, I think it's important for the listener and who might be the reader to always remember who is the person telling the story. So Abigail Schreier is not in mental health care. She's not a psychiatrist or a psychologist or a therapist, but she was a former patient. So she talks about her prior experiences in therapy as an adult, young adult and older adult, with mental health care specialists that include, I think, mainly psychologists and therapists, maybe even a psychiatrist. I don't remember that detail, but she, and the way that the book is written to me speaks as a parent who has never had a child who actually dealt with a mental health care crisis. So I think that's really important, because if you are a parent, and I think the Parent Doctor and Do Better MD, our focus and our mission are very similar in terms of wanting to empower parents to do a better job with their kids, is writing from a lens of having that inner experience of what it's like when you have to decide whether to call 911 for your kid. If you have that kind of experience, this would have been a very different book, I think. Yeah. But so I think that that's really important for the listener to hear. And I'm not saying that parents and patients who have gone through mental health care may be dissatisfied and may be frustrated, but I think that's a lens important to have when you read the perspective from her. But I have so many things to talk about. I don't know if we're gonna have enough time, Dr. Cotto.
We could really talk for hours and hours. I know. But as you're talking, I'm realizing, you can take this stance about so many things. You could talk about bad teachers and how the academic performance of American students is declining and it's all the fault of the teachers. Does that mean that there are not wonderful teachers and that some kids aren't getting an excellent education? No. Right. I think your point is a very good one, which is that the perspective of a parent who has a good relationship with their child, who has a child who's mentally healthy, who has never had to worry about, their child's behavior in a dramatic way, like worried that they're going to send their kid off to school and they're going to go do something to harm someone else or harm themselves. And those things, when they happen, are really disruptive in an all-encompassing way, both for the parent of the child, for the teachers working with that child. My sister is a guidance counselor at a middle school in New Hampshire. So she's on the front lines of all of this. And when there's a kid coming to school and the parents calling saying, last night he or she was saying that they wanted to harm themselves, can you search their backpack and see if they brought, a knife to school? That's a tough situation to be in. Yeah. But from her perspective, as a parent who I assume has a good relationship with their child and has a healthy child, she described in the podcast that I listened to, I think she said her child was about like 11 or 12, went to the doctor for their pre-sports physical or something. Was this in the book too? And they had that questionnaire. What is it called? You knew what it was called.
It was the CSSRS. It was the Columbia Suicide Severity Rating Scale, which is a standard rating scale that we use as primary care providers and psychiatrists to assess for suicide risk. And the recommendation in general is to start at age 12 to do these assessments.
And I can understand both points of view. For me, I don't know if it's my personality, but like, I think she's right that it's wrong to ask a parent who's got a good relationship with their kid as they're bringing their child to the doctor as a responsible person, like to leave the room so you can hand the kid an iPad with these like serious questions. Like, have you ever thought about ending your life? Like, that's a sudden serious question out of the blue from someone you don't know handing you an iPad. That's not the way it should be dealt with. But at the same time, I think it's wrong to say we shouldn't ever ask those questions, because there are so many, there are probably millions of kids who really need someone to listen to them. And you and I know, and we've seen these, taking care of these patients, establishing a safe place for those kids who need the help to reach out or let you know that they need the help is so important. And that's something that we've taken an oath to do as physicians. But the problem is that in many busy clinics, and Kaiser was like this too, the physician appointments have gotten squeezed such that I'm not administering that CSSR. I'm not asking those questions to patients. It literally becomes an iPad handed to the patient while they're in the waiting room before they come to see me, and everyone has to do it. And I think that's really messed up. Like, I don't think there's much value in it. And I do think it's messed up to ask a kid who has, this is asked even of a child who has no relationship with me, like in their first appointment with me, to answer these questions. So I think she has a point that it's not the right way to go about it. It's like a good intention was there. And that's why this got put into place. We're like, okay, we'll screen everybody with this. But the way that ends up happening in most clinics is probably, it's definitely not the best way to do it. I don't know how it's done for a clinic and at the PHP level. Probably you have better relationships with people in a PHP where you're working with them so intensely.
Right. And I think the other challenge that is not addressed in this book is actually beyond therapists and schools and mental health providers, but the system of care outside of mental health care. We are so strained. There is a shortage of mental health care professionals. There is a shortage of good therapists. And I mean, there are a lot of things I agree with that I do want to mention, and a lot of things I disagree with, but she does raise some very important points. But going back to this topic of the suicide screening, you know, the US Preventive Task Force no longer advises doing suicidal screening, which is, as a child psychiatrist, is absurd, right? I think that's absurd. And the reason why all clinics, you know, primary health care as well as behavioral health care are doing these screenings is because, as you mentioned, we don't have the time, Kaiser. Like when I worked in outpatient mental health care a couple of years ago in community mental health care, I was booked back to back to back to back. If I get that information beforehand and it's a yes, that helps me, because usually as mental health care providers, we know it might not come out in the first 2 minutes. It might come out in the last 2 minutes. And then you have to extend your visit by 40 minutes to really do a thorough assessment because it finally comes out. So there are benefits to doing that. And I think because we are trying to find ways to fund care, I think insurance companies and lots of different systems that really pay and don't pay if you do or do not do certain screens, there are incentives that are built in there that has nothing to do with paying me as a psychiatrist or the therapist. It has to do with paying the company running the organization that builds an initiative to put that in there so that they can check off a box and they can get more money. So I think that there are bigger factors at play. And that also includes going back to COVID and the mental. I mean, both you and I were working throughout COVID. I worked full-time throughout COVID. I was the only person going in person, me, the medical assistant, and the front staff. We were the only people going in person, plus patients. Therapists were at home, the psych NPs were at home, but as the medical doctor, I had to be there in person, which I think was important because we have kids that need help. But I think that when it comes to thinking about who is doing a better job or a worse job, we all could do a better job. And there are limitations to what that can be in the world we live in, you know, and the system that we have. And I think going back to just the name of bad therapy, I do think there are bad therapists. I think that is true. And I think that there are fantastic therapists, and that is also true. And I unfortunately think that there are a lot of bad prescribers. And I think that that gives child psychiatrists like you and me a bad rep. But I think a lot of the bad prescribers are not trained to the level that they should be to make the nuanced decisions. So, you know, when she speaks about medications and kind of parents kind of being forced to give medications. You and I prescribe medications. We know there are no parents that will let us prescribe a medication easily. Zero. I've taken care of thousands of kids. Even the parent that comes in knowing what medication they think they want or they believe will be helpful, it is still hard to get them to give me a yes, because there is such conflict internally about giving a medication for any mental health care concern on that behalf of a parent, a guardian, CPS worker. I mean, this is not just biological kids. Like, everyone is really cautious about medications. But I think because unfortunately there are not enough good therapists, I think pediatricians are stuck in a position where they are in a really tough bind because they can't get in to see a good therapist. They can't get in to see a psychiatrist. So they're stuck with medications, they're stuck with Prozac. So I think, again, this is a system outside of what she touched upon that I think is really important for us to consider. And again, I think patients' parents may not be aware of the system, but it's something that also deserves a discussion.
Yeah. I mean, it's just I agree. It's a big systems issue. She also touches on, and I think this is true, there's sort of a generational switch with like millennial parents of Gen Z kids being generally more permissive, gentle parents and being more readily able and desiring to defer expertise to someone like a therapist or a doctor. And again, I think the critique here is probably misplaced on the therapists. I think the therapists are trying to do the right thing, but I think you're right. There are a lot of inexperienced therapists, very green therapists. Often these are the people in our state, at least, it's probably like this everywhere. To get licensed as a therapist, you need to accrue a certain number of hours. You usually do that under someone else's license in a community mental health setting. So people who have Medicaid, right? I say Medi-Cal because here we call it Medi-Cal, but like low income families whose kids are getting mental health services are more likely to get inexperienced therapists, which is a shame because those are the kids who really are more likely to have trauma and really be more likely to need an experienced therapist. But I'm sure you've seen this too. I mean, I've talked to many adults or young adults who say like, oh yeah, I had this therapist, and then they'll tell me the thing the therapist told them and how they behaved or responded. And I'm like, ay. Like, they were being nice and trying to do the best they could, but their training as, social work therapists, LNFTs, their clinical training is much less and they don't get as much direct experience. In the book, Abigail Schreier kind of says that most psychiatrists don't do therapy, and that's probably true across the board, but it's not true of all psychiatrists. I'm trained as a therapist, you're trained as a therapist, like many psychiatrists do therapy as well. And if you have a child who's really sick, that's the person you should be seeking, because we probably have the most training on what is really a severe mental illness, what's the thing you really have to be worried about, and how do you empower someone? Because I do agree with her that there is a new bias among young people to kind of glom onto a label like I have anxiety or I have ADHD or I'm depressed, and then use that as get me out of jail free card. No, that's the wrong thing. But basically I can't go to school, I have anxiety, or I can't take the test, I have anxiety. I can't go to PE because I'm anxious. It's like, no, you can go to PE. You have to go to PE, in fact. And many of the therapists that I've supervised and worked with, they don't get this. And my sister, who's the guidance counselor, she goes crazy because she's like, we're doing the disorder. That's Lynn Lyons talk for, we let anxiety run the show, when we let the things that doesn't want to do be in charge of what they can do. Like, no, that's wrong. And I think I agree with her in that she's right. We need to be a bit firmer there. And I like that she talked about Dana Baumrin's research that, firm, loving parenting, authoritative parenting is the best. But the second best is not permissive parenting. The second best is hostile and loving parenting, where you're just like, no, you're going to school because it's good for you. Go. So we do need to do better at supporting the millennial permissive generation of parents to be a bit more firm and not be afraid that they're going to break their kids. And in fact, let them know that because we believe in them, that's why they have to do this thing. So there were many things I agreed with her about in the book, about the need to restore normalcy after a trauma. Don't let a kid who's lost a parent like stay out of school and not do homework for months. Like, encourage them to go back to school and be with their friends and function as well as they can. But it's tough. It's tough because can't make blanket statements like this, because as you and I know, there are kids who can do that, who can instantly kind of step up after a challenge or a traumatic event. And then there are kids who can't. And I feel that she kind of was saying, I don't know, another thing that made me bristle was her criticism of like Bissell van der Kolk's work in The Body Keeps the Score. She also criticized Gabor Mate, who I really love Gabor Mate. So like there were some things where I was like, hey, now don't criticize Gabor Mate. But you know, and I honestly don't think she's ever read The Body Keeps the Score, because she was talking about it like, you know, you stored trauma in your elbow. It's like, no, that's not what that book is saying at all. So there was some misrepresentation as well. It's complicated, like, you know.
Yeah. And like going back to the statements about the therapist, I think that's really important. Again, the book's called Bad Therapy. And, you know, there are some bad psychiatrists too, right? It's not just therapists, but I think your point about inexperienced therapists is really important, because she does suggest, which I totally agree with, that you should vet your therapist for your kid just like you're vetting your surgeon. Totally 100% agree. And we don't do enough of that. I don't think parents do enough of that. You need to see someone who is, not need. I would strongly advise that you see someone for your child who is at least a psychologist or a psychiatrist that does therapy, or at least a licensed clinical social worker. And they can
reach their licensed hour so that they
right.
have yeah.
Right. And you ask them, how many kids have you taken care of like my kid? What are your specialties? And I think we don't, you're completely, correct that the most needy, most impoverished people get the least experienced people. And that was a challenge that I had in my prior job where I worked in community mental health, because here I am kind of at the top of my game. I can always be better, but really experienced, because we as psychiatrists, we have that training in residency. We have 5 to 7 years where we can make mistakes and learn from those mistakes with a supervisor on us all the time before we actually are a fully fledged attending like we are now. Whereas I think a lot of these therapists, their clinical supervision hours, it's not clear to the patient that they are in training, right? They don't share that. So I think parents need to be empowered with that information. And I think in terms of thinking about why psychiatrists don't do therapy, it's also, again, going back to managed care. Managed care does not reimburse psychiatrists through insurance well to provide therapy. That add-on is really not well reimbursed. And most of us have been trained as a part of our training for specific types of therapy, CBT, psychodynamics. Some of us have gone through psychoanalytical training. Some of us have done IPT. All of us have been trained in therapy. But when we work for managed care, we get paid to prescribe Prozac.
Yeah.
We don't get paid to do therapy.
In most situations, you can only do that. Like they only want you to do the med visits because they can pay less expensive people to do the things that reimburse less.
Right.
So again, and this is where now I'll get on my soapbox about how people have this false belief that their health insurance entitles them to good mental health care, and it doesn't. Like essentially that's emergency care, right? But if you want good mental health care, you're probably going to have to pay for it outside of your insurance in some fashion. Now, whether it's the whole bill or part of the bill, because most of the care that you get in a managed care setting in most places is not going to be what would be best for you, really.
Right. And the reason why I will say excellent people like you and me at times are limited about taking insurance is because we know the quality of care that we give. And if we're sitting with you and your kid and your family for 45 minutes, which is typically what happens, if not an hour, to provide therapy and medications, and the insurance company pays me $20, that does not make sense for me, right? I have to, and that might sound hard for families to hear, but this is true. And it's a reality of how we also have to pay back our loans, which are $700,000 plus because we went to med school and became a psychiatrist versus, other ways to practice. But I want to kind of go back to like some points about the book and working with inexperienced therapists, because I think what I do think that she states in the book is that she kind of describes kids as being so malleable and so impressionable. And I agree and I disagree. I agree to the extent that as therapists and as psychiatrists, we have an instrumental role to play in terms of forming the identity of a child working with us, 100%. The first therapy that I engaged in was actually in school. So in school, when I was in high school, my dad died of cancer when I was 14, the day before my last day of high school. So that day, of course, I'm a straight A student, right? So I go to school after he dies, and I see a social worker, a licensed clinical social worker who they just introduced me to. She then becomes my therapist throughout high school. I didn't even realize I was going to therapy, to be honest. I don't think my mom even knew I was going to therapy. That's, again, a whole other issue, but she was great. She was wonderful. Her name was Thea Cohen. I'm greatly indebted to her and my resilience in being able to process things. And she was instrumental to my concept of self, decision-making regarding colleges, decision-making regarding my interaction with my mom, because I worked with her from 14 to 17, right? I'm forming my identity. And I think when we have inexperienced therapists, and I will say even psychiatrists, psych NPs, all of us, when we use diagnostic terms, kids latch onto that. This morning I did an admission for my higher level of care PHP, which is between clinic and inpatient admissions for those listening. And she said to me, she was in community mental health care and coming to a higher level care. She said, my therapist says I have PTSD. My therapist says I have ADHD. My therapist says I have depression. I'm looking at this kid. I'm like, I don't know if you have any of these things, kid, but I can't say that yet. I'm building rapport, building an alliance with her. So I asked her, do you believe this? She's like, I don't know if I believe it, but she's a therapist, right? She has to know. That's how they responded. And also in the book, in most states, therapists cannot diagnose you. You have to have a certain level of training to have a diagnostic ability. And I know in the state of New York, for example, counselors just recently gained the ability to diagnose someone, but a licensed counselor is considered a therapist. So we use terms, I think, in the medical community and mental health care community to describe discussions between each other. And then that language comes out with patient care, and they're speaking a different language. And I think that is also what was not quite said in the book, but is important to recognize. That's why these surveys come out the way that they do, because the surveys are written by medical personnel. Suicide and definition of suicide, they're, as you and I know, but parents might not know, there are very specific terms within the suicide language that we use as psychiatrists and mental health care professionals, but kids may not use. And I think that there is a dissonance between the language that's been created through the DSM for medical professionals to discuss on the same language, same term to really describe symptoms in clusters, and what young people have started to latch onto as their form of identity. So I have, blogs on my website. I talk about the cactus kid, and I talk about how every kid's kind of born as a little rosebud, right? But certain environmental factors and maybe internal factors can evolve kids to be more like a cactus, where they're more prickly because they have to survive in their dry, arid environment. I'm from Arizona, right? So I think that's important because inside we want them to get back to being a rose, right? They're not really a cactus. They are a rose, and we have to see their potential. But if we start talking to kids as if they are a cactus, you are a cactus, it becomes hard for them to see themselves differently. And I do think it is important that she drew attention to this, because I think we as the medical community and mental health care community have to take an active role in thinking about how we talk to our kids, how we talk to our patients, how we talk to our parents, and the impact of that. And I think that sometimes we just don't have that mental capacity, because this kid's coming into me at 5:55 on a Friday with a crisis, right? I don't have the capacity at that time, I'm very sorry to say, to speak with you with that nuanced ability. I'm going to say ADHD and bipolar, because I got to get out the door and my brain is fried. And that's another thing that's not touched upon, really the burnout in mental health care, the burnout that we all experience that really makes it very hard for us to be our best selves with every single patient. Man, I'm going all over the place, Dr. Cottle. I am so sorry. I feel like I got 1,000 things to say.
That was really, really good. Okay.
And I agree with her when she says, we have to give kids a chance to make mistakes. Totally. I do think that there's a fair amount of helicopter parenting that we're all kind of have been engaged in. And I do think that there are reasons why so many parents that come to us, and both you and I, Dr. Cottle, are focused on parents because we see the need to help support parents as they go through mental health care. As our kids go through mental health care, it is very trying. It's very difficult, and one thing that she says in her book on page 218, she says, you as the parent, you can decide whether or not your child is in crisis. And she kind of talks about this, a kid who has minor cutting. how can a parent know if it's minor cutting, right? First of all, but minor cutting, and that, you can kind of figure it out and decide if you want to escalate or not. This is a really difficult thing for parents to do. I believe we can train parents to do this. I think we can do a better job. I have a course on this, but it is not something that's intrinsic to us as parents. I know I'm a psychiatrist. I've seen cutting all the time. If the day comes where my sons come to me cutting, I will be panicked. I will not be able to think straight. In this book, she recommends hold your head straight, make a decision. But we know as psychiatrists, it is not easy to do. It is very difficult to keep your cool when your kid is in crisis. And I think that's why so many parents, she says lots of kids in psychiatric care, their parents don't really like them. And I think it's because when you have crisis after crisis after crisis, and you're not really able to manage that crisis, it was very frustrating. And when you come to mental health care professionals that don't know how to tell you what to do, it's frustrating. And that's really why I think both of us have started our own missions to help parents, because we know we are lacking as a mental health care professional and society. We don't focus enough on empowering our parents with those tools because frankly, we don't have the time. So we have to do extra things, right, to really support our parents.
That's why I left my clinical job to build the parent doctor. And that's why you're doing Do Better MD, because we feel so passionate about this. Absolutely. I don't think there's any good in calling it bad therapy. I don't think there's any good in calling parents bad parents. I don't think there's any good in calling kids bad kids. We're all doing the best that we can.
Absolutely.
Of course, there's going to be inexperienced therapists before there are experienced therapists. That's true for every career, every human. Like, it's part of the trajectory.
Mm-hmm.
Doesn't mean that all people who dedicate their lives to mental health treatment are bad people. No, not at all. But yeah, I think it's ridiculous to think that a parent who has a kid in crisis can really have the confidence to trust their gut to know whether this is dangerous cutting or not dangerous cutting. I mean, it would be terrifying. I mean, you and I have both seen kids who come in with like scars and slices on their thighs, up their arms, on their necks, everywhere. And if you as a parent saw your kid coming out of the shower, and kids get shy in adolescence, they cover themselves up, they're head to toe in hoodies and sweatpants. If you happen to walk in on them and see them covered in scars or see them cutting or see wounds, it's going to be pretty hard for you to just say like, oh, I see, that's just superficial, no big deal. And what are you supposed to do? Just brush it off? I mean, you're not supposed to brush it off either. Clearly, It's not normal. So yeah, I don't know that it's that helpful to tell people like, trust your gut, if that's what she said in the book. I very much skimmed the book and I listened to the podcast that she had, and I read a summary of the book. So I don't want to overstate. I may be misrepresenting what she said in the book, but I think ideally parents will know that they can trust pediatricians, mental health providers, but even there, often it's a mess. I've had to talk families through when they go to the pediatrician and then something comes up, right? Like the kid does reveal that they're feeling suicidal. And then the pediatrician, who's busy and has 15 other patients to see before the end of the day, calls in whatever, or sends them over to the ER or gets the police to come and bring the kid to the ER. It becomes very rapidly this very escalated situation where the kid can't have their phone because they could break it and use the glass to cut themselves. They can't have their clothes. They can't, so now the kid's basically been all their stuff taken away. The parent doesn't know what's going on. The kid's in the ER, and I come in as the psychiatrist to do the 5150 evaluation. Right. And I have to explain that like nobody meant for this all to escalate in this way. But again, it's just like, this is how the system is. And if your kid says that they're suicidal with a plan, then this is what happens. Right. And it's not anybody's fault. It's all designed to try to prevent something really bad from happening. But nobody has the time to explain to the kid and the family what's about to happen. So the doctor just like walks out of the room, sounds the alarm, and then A, B, C, D, E happens afterwards. And it's really a mess. Yeah.
And that is a really traumatic experience for families, and where I work now in the PHP, I've chosen to work there in part because I like working with high-risk youth, but I have to have a team. I have to have a team that I can work with, because in the outpatient setting, I would get these crisis kids and I was all by myself with an inexperienced therapist, and it was really, really very difficult. But I think the other piece is that's again not touched upon here, is that the bulk of mental health care is falling to primary care. Mm-hmm. So I am involved with initiatives in Arizona to build their pediatric mental health care access line, where they can call in. Most states, almost all states have already an access line where primary care can call and talk to a child psychiatrist and receive guidance on complex cases. And then also there's an educational component to really educate primary care about how they can really use medications, become aware of anxiety, depression, and mental health care issues in kids. But the stress is falling on their shores and knocking on their doors. And they are far more stretched than we are in mental health care. And it is really a lot of pressure to put on them and a great expectation, because I know when I worked in clinic, the times that I decided to admit a child, that's a 3-hour process minimum, just to like, first it's an hour to help figure out if they really need admission, and it's another hour to explain to the kid and the parent and get them to agree, and then to wait for the ambulance or go. And it's just such a process. And then once they get to the ER, again, this is not in the book, but this whole process of figuring out the level of crisis and the level of intervention is really nuanced, challenging, and really could be served if we had a stronger, robust outpatient care. I feel like if they reimbursed outpatient care and valued mental health wellness initiatives for those of us working in the barracks, right? Working as the foot soldiers, that would help. But I think right now it's not just a crisis for kids and parents, but for those of us doing the work, because it's so much to take on. And there's a futility feeling, right? You just feel like you're putting a Band-Aid on a crack in the Hoover Dam. It's just not enough.
Yeah, totally. Yeah, which is why you and I we're trying to go around, because we know that the answer really is empower parents. Like people like you and I, who have so much knowledge and information, need to be a voice to help parents know, like, what is a true emergency? When should I be really worried about my kid? And what are the warning signs beforehand that are just normal teenage hormonal behavior? Or is this something that could become a bigger issue?
Right.
I will say, like, one thing I agreed about in the book was she's very anti phones and social media, and I am too.
Are you a parent who wants to read all the parenting books and you have maybe a growing list or stack on your nightstand, but somehow you just never seem to find the time to get to them? If so, I totally relate to you, and I want you to know I'm here to help. Every month on the third Wednesday, I read, summarize, and present a parenting book that I have chosen that I think is a great one. And I do this via Zoom. If you'd like to get into the Empowered Parent Book Club, go to theparentdoctor.com/book club. This is totally free. It's a public service that I provide. And everyone who signs up gets access not just to the replay in case they can't make it to the live Zoom, but also to an actionable PDF that I create custom for each book that we read. So I would love to have you. This is a growing community now of over 200 members. These are like-minded, engaged, energized, supported parents who want to be more empowered for the sake of their kids. If you'd like to join us, again, please go to theparentdoctor.com/book club. See you there.
And so she was critical that mental health professionals have not come down in a more unified stance to basically say, like, kids shouldn't be allowed to have phones. But again, this becomes a very difficult politicized thing. It's controversial. I was just talking to my brother-in-law, and he thinks it's pretty ridiculous that they're trying to not allow phones in LAUSD schools now. He's saying they make the kids turn in their phones, but he's like, oh, they just need to have 2 phones. And I'm like, well, you're kind of missing the point if that's the way you're going to go about it. It's just like, buy your kid another phone. You know, it's ultimately like, can we just let our kids have some period in the day where they're not on that device, or they're just interacting with each other face to face? And I've been saying for years that I'm not getting my kids a phone. Now, my son just turned 12 this weekend, and we're definitely getting closer. I mean, what is it? The statistics are that like 69% of 12-year-olds have smartphones. So he's already in the minority. Many of his classmates have smartphones. He knows that I'm against it and he's not going to get one. And I told him, like, when you get a job and you can pay for the phone, then you can get one. And until then, we'll be working on teaching you how to responsibly use a phone and all that stuff. But thankfully with a boy, I think I'm a little bit luckier because he's not really into social media and all that stuff. It's going to be a bigger battle with my daughter, I know, because she's going to have whatever it is, then it'll probably be something new. You know, but the TikTok, the Instagram, the Snapchat, the Pinterest, all these things, they are really attractive and they're really dopamine driving apps that kids want to have access to.
And going back to her argument about therapists molding identity for kids, again, she didn't quite say that, but that's what she's alluding to, which I agree. So does social media. Social
Totally.
media, we are evolving kids with ADHD. We are evolving kids who have poor attention spans, who feel that they can change their trajectory of attention at a swipe. We are training our kids' brains to be very different than how life functioning needs to be. If you want to hold a job and want to produce something, even if you want to become a YouTuber, even if you want to become a social media influencer, you still have to have attention, persistence, do the same thing over and over and over and over and over again before you actually make money. And that kind of persistence and attention, I think social media is really destroying.
Right, because it just shows the end result, the pretty thing. And it builds a lot of envy, I think, too, because we see so much. I was thinking about this recently because I just wrote an article. There was that Parents Under Pressure advisory from the Surgeon General last week. Did you see it?
No, I didn't tell.
So, he put out the, teen mental health advisory, child mental health crisis statement or something in, I think, 2021 or 2022. And
about
then
social media and online screen time and kids. Yes.
Yeah. And depression rates and all of that. And now there's a Parents Under Pressure advisory, basically just stating all these astounding numbers and statistics, most of which came from the 2023 APA survey of Americans about where their stress comes from. And then they break that down, and the parents in that survey, it was like 3,158 people. So again, I don't know how biased that is, because busy, successful people, I think, are probably less likely to open and respond to a random survey from the APA. I think people who have the time are probably somewhat selected for as people who are, I don't know. Do you know what I mean? I think, if you get something in the mail or in your email and you have the time to do it like that, no one I know would have the time to do that. So I think there's probably some degree of response bias in the people who respond to this survey. But the numbers were still just astounding. So they asked people to rate, do you strongly agree, disagree, strongly disagree about these different topics or statements. And one was, most days I feel so overwhelmed I cannot function. And 41% of parents said yes. And 20% of non-parents said yes. And the next was, I feel so overwhelmed most days that I can't focus, or something that's more mild than cannot function, but it was still pretty severe. And 48% of parents said yes, and 26% of non-parents said yes. So it's almost double the rates of complete overwhelm by parents. So then it dove into, why, and they talked about all the things we already know, right? Like, financial stress is more for parents than non-parents. Well, duh. I mean, you have to do childcare and you have more mouths to feed and all this. And parents are working more now than they were in 1985. Parents are spending more face-to-face time directly caring for their kids now than they were in 1985. Parents, 70% say it's harder now to parent than it was 20 years ago, which is interesting. I find that fact, I mean, it's how we feel, right? Do we feel like it's harder now than it was 20 years ago? Most of us who are parents today weren't parents 20 years ago. So we're kind of projecting what our parents felt. And I don't know if it is harder to parent now than it was. It's different. It's certainly really different. But many of the things that we say make it harder should also be able to make it easier if we were to use them in the right way. Technology and social media, if we were to use that to connect ourselves with other people and build a village, it could be great. But many times we're not. We're just alone scrolling our phones and feeling isolated and alone, and like we don't have the things that we see. And that's what I see most teenagers doing too. I don't know about you, but so many of them are just basically promoting feeling crappy by scrolling on their phone and looking with envy at all the things other people have that they don't have.
Right. And the parents are doing the same thing too, right? It's not just the kid. It's us as adults doing the same thing. And, one quotation I did want to bring out that I really, truly agree with that she said the statement that, we as parents, our generation, are being driven to learn more skills. We are reading all the parenting books, following all the gurus, trying to do the best thing possible to have gentle parenting. But parenting is not a skill, she says. Parenting is a relationship. So I 100% agree with that. And I think the advent of the smartphone and social media has made us disengage from our relationships in real life with our kids, with our spouse, with ourselves. I think this is a challenge we all have. I mean, every time we go to to dinner, go out. It is a battle with whether or not we give them, our kids, I have two boys, 9 and 6, their tablet, right? Because I want to have a conversation with my husband and I want to have a conversation with the kids. And, I think for a lot of parents, myself included, I will not say only other people, myself included, the device has become a parenting skill. It has helped make life easier in so many ways by keeping them safe in one spot, focused on something that I believe is not going to be dangerous to them, although we know that can be very different. But I think it is really hard, I think, as a parent to not feel blame, not feel a sense of blame from not just medical professionals and mental health care professionals, but then with all the things that happen on social media, I think that the pressure that's happening in Congress and monitoring things, I think that as parents, it is our responsibility too to become aware of how to monitor these things for our kids.
Yeah.
And become invested in that proactively versus reactively after they saw porn, on YouTube, right? Like that's the problem.
Absolutely. I mean, I think I recognize that I'm not going to succeed in not letting my kid have a phone before he leaves my house. At some point in his adolescence, he's going to get a phone, probably in the next few years, that's going to happen.
Yeah.
But I really view it as my responsibility before then to make sure that we've had conversations, and we actually already have had conversations earlier than I would have with him based on his development, his expressed curiosity about sex, about porn, about people conning other people online, about scams, about internet privacy and passwords and financial data, like all these things. I mean, you really have to prepare your kids. I went off to college and had never had a credit card.
Right.
I had seen like a Playboy magazine once. My friend showed it to me. It was like under her older brother's bed, but like that's all. Like that was my only introduction to anything pornographic. And we have to understand that when you give your kids a phone, more so, I think, although even on the tablet, that's happening too, obviously, parents need to be aware. Like it's our job. We have to have there's software you can get that'll prevent your kids access to things. There's software you can install that'll let you monitor what they're doing. And you need to be doing that so you can have these conversations, because otherwise they're going to be on their own. And it's really kind of alarming, some of the videos that people can now watch with the click of a button online, both violent things and sexual things.
And I do think that the challenge that has happened with mental health care is that after there has been some kind of exposure, some kind of challenge, then we see shifts in mood, anxiety, whatever that can come up. And we may not really know ever the root cause. That child might never actually divulge that. So then the issue becomes the child, and then they come to a mental health care specialist to fix and find the problem. Right. And then the fixing and finding of the problem ends up with a diagnosis, which actually may not be completely accurate. And it may not reflect the true issues going on. Yeah. And then it's the therapist and psychiatrist job to fix the problem. And we don't have enough time built in. Honestly, insurance companies, if anyone is listening, insurance companies, you should be paying Dr. Caudle and I to do parent work. We should be paid to do family therapy. We should be paid to have add-ons to do the intensive work with our parents that you and I are already doing, right? But that would help improve our ability to build in time to really support our parents in the ways they need. Because at the end of the day, no matter what therapist they were brought to, what pediatrician, what survey they did, they are in mom and dad and guardian's home. Yep. And that is where the bulk of the work needs to be done. And if we don't support our parents who, as the survey just mentioned, are feeling pressured and stressed, how are we going to expect our kids to do better? How are we going to expect them to improve if we don't support the support?
I think it just becomes this downward spiral, because like the parents' mental health due to all the pressure becomes worse. When the parents' mental health is down, the kids' mental health declines. When the kids are suffering, that's a number one trigger for parents to feel overwhelmed and stressed. And so then it just feeds on itself. And we see that all the time. I mean, this is why I started the parent doctor, because so often a kid wouldn't come to the child psychiatrist for medications for a big problem until they were a teenager. But as I started to take the history and become a detective and like unearth all these things, you realize that it is about relationships, and the relationship was problematic from 5-10 years before. Right. And so if I could have met this family when the kid was 5 or 6 rather than when they're 15, 16, I could have had a much greater influence on the parent-child dynamic, on how the kid was doing, on the parent's view of their child. Because it's true, like when a parent has to bring their kid to a child psychiatrist or a therapist, there's a certain shame and feeling that you've failed your kid innate to that process, I think, because no one has a baby dreaming of the day they get to bring them to the child psychiatrist. No.
Right.
Excited for, like, I can't wait till their first Prozac prescription. No, like,
Right.
So of course there's some shame, and then there's also some repelling, I think. Like, you don't want to be associated with it. You want it to be a problem that's not about you, that someone else can fix for your kid. So I think on both sides, on the kid's side, because of what they see on TikTok, social media, maybe from bad therapists, like the labels that they get, that they glom onto, like, it's not me, it's the ADHD, it's not me, it's the anxiety. Yes. And then from the parent side too, they want to believe also, it's not me, it's the social media, it's not me, it's the school, it's not me, it's the violent video games. Again, but there's this lack of ownership about it that doesn't serve anyone. And right. It's not that we're in collusion with it, doctors who are working in managed care settings or in anything that takes insurance, but in order to get paid, you have to put a diagnosis. You have to. You can't spend hours with parents about what's really going on and how they can really make it better. You have to simplify it down to, like, okay, well, what am I going to call this? You can't even call it like parent-child relational problem. That's not going to get as much money as you call it, like, post-traumatic stress
adjustments.
Or adjustment disorder or anxiety disorder. You have to get, like, really specific for the billing to go through. So there's this, like, misalignment of desires. Because really, in order to help, and she brings that out in the book, which I do think is a problem, that, like, she says, in order to keep getting paid, the therapist has to keep saying there's a problem. And there is sort of a mismatch there. Like, ultimately, we want people to get better and we want to graduate them from therapy. But at the same time, there is that label and assignment of the label to the child or the person. It happens with adults too. An encouragement of them to accept that, like, this is kind of your lot in life. You've got this problem. You're going to have to learn how to live with it, and manage it the best that you can. And I don't think that's the best approach to have. But at the same time, you want to validate a person's experience, but recognize that they have the potential for more. Like the cactus, I love your cactus rose analogy there. Like, yeah, right now you're a cactus, but that doesn't mean that you can't change course.
Right.
And get back in touch with the rose.
And I do want to disagree with that point that you brought up about her saying that, there's an incentive for therapists to keep low risk patients in therapy for a long time for payment. I think that is really sad. And I don't think that is the goal for most therapists. Also, for therapists, you're supposed to have a treatment plan. That means you're supposed to have a paper that you give to insurance companies saying, what are your goals of treatment? How are you meeting them? When are you meeting them? And you're supposed to actually be showing progress or worsening and documenting that. So I want the listener to be aware that although she makes that argument, there are some things in place to really prevent therapists from just keeping people sick. And I don't think at all any of us want to keep people sick. Most of us are really trying to get rid of patients. We are trying to take care of you, get you fixed, and move forward.
Move forward. The door. Yeah, exactly.
Right. We're not trying to keep you if we don't need to. And I know for myself, for example, I'm in private practice. I see private practice patients. I cannot give a suicidal kid good care in my private practice. I don't have a therapist working with me. I'm by myself in virtual care. I'm trying not to give medications. I'm trying to use vitamins because I'm an integrative psychiatrist. So this is not the best place for you. But if you come see me in the PHP, where I have a psychologist and a family therapist and group therapy, that is where you can come see me in Bradley and I can take care of you there because that has the system that will help you be successful. So when we are looking for care for our kids, I think going back and doing your research to find out, what do I really need? How do I assemble a team of people that work with me along with the therapist to really help my kid and me is really important. And something she didn't mention, again, going back to therapy, is that therapists have a very high level of confidentiality, especially when it comes to teenagers. So as a result of that, they want to have a strong alliance or connection with that patient so that they can be honest with them. And oftentimes that means they cannot have a close relationship with the parent. But as psychiatrists, as medical doctors and therapists, our roles are different. And we have had training to really navigate that nuanced dance between confidentiality and building an alliance of with both the parents and the child, which is a delicate dance that we know because oftentimes there are step parents and divorced parents and grandma. So we are really trying to navigate a lot of systems and a lot of different relationships to really help that child. Went off my other, I don't know what tangent I was on just now, but my point is, I think that it is important that we are more critical as parents. And, oh, that's the other thing I want to say, that you had made the statement about parents really having a hard time taking responsibility and feeling blame. And that is true. And on the other side of that coin is having the power, having the control back, having the ability to know what you need to redevelop the relationship between you and your child. Because it's really not about you. It is about us. It is about the relationship between you and your child, between you and the mental health care provider, between you and the school. These are the relationships that can sustain your child. And that's the relationship that will save your child.
I love that. Yeah, I didn't mean to imply that people should feel shame when they bring.
Oh, no. You were, but I think
that's a very common thing.
Yes,
that people do end up feeling. But yeah, through that pain is the answer potentially on the other side. Like once we let ourselves be vulnerable to admitting, like, I've done everything I know how to do, and I don't have an answer. And that happens to me with my kids. I'm sure it happens to you with your kids sometimes too. Like even as experts, we don't always know what to do. More minds are better than one. So, seeking help, I think, is so important.
And I, like, on my podcast, I have a Fix It Friday because I make mistakes, right? There's a saying in child psychiatry that being a parent makes you a better child psychiatrist, but being a child psychiatrist doesn't always make you a better parent. And it's true, right? Like sometimes we need that self-reflection to say, oh, wow, I could have done it differently. I could have fixed it. Let me try to work on it next time. Oh, and that's, I think, so important. You know, I hear parents come and tell me all the time, well, they didn't realize child did not realize they made a mistake. They didn't apologize. They didn't rectify it. I think that the power of parents as a model is so important. I have had to remind myself to say sorry to my kids. I have had to remind myself to apologize. I've had to remind myself to think out loud, to speak out loud, so they can hear when I'm indecisive and finally make a decision, because they can't hear what's in my brain. They can't hear me as a mature, hopefully mature 40-something-year-old woman having that ambiguity and that conflict and then coming to a resolution. But if they can hear me and they can see me apologize, they can do it too. It's not such a thing to apologize.
I practice that a lot. In fact, I practiced it this morning. So I am 47. I'm in perimenopause, and I'm like in the end of the luteal phase of my cycle, which for me is this period where like just my emotional reserves bottom out and I just feel crap. So my daughter this morning was having a hard time because it's Monday and they've eased into schools. They had like Wednesday, Thursday, Friday the first week, and then Tuesday, Wednesday, Thursday, Friday last week. And so today was the first Monday, and she was just this whiny second grader, like, I don't want to go to school, and like didn't want to put on her backpack. So we live in a high-rise building, and at the elevator, I'm like carrying my big bag for the office, my purse. My husband's trying to help her out with her backpack. And I was like, just give it to me. We got to the elevator and I threw her backpack on the floor and I was like, just put it on. And then I had to laugh at myself. And I was like, okay, that was a pretty ridiculous tantrum, but mommies get to have tantrums sometimes too.
Right.
I know I'm not at my best right now. I like literally just threw your backpack on the ground, but like, I am fed up. I'm done. Like, and she put it on, and my son backed me up, because they need to know that like, there's times when our kids throw fits and they're real fits. And then there's times like this time when my daughter was really just pushing the envelope, and I need to let her know that like, I can't handle that today.
Right.
And I think that we have a really strong relationship because I absolutely apologize to my kids all the time. Because I'm not perfect. You don't have to be a perfect parent. I mean, I use the analogy because my husband's really into baseball, that like, if you're batting 300, if you're doing the right thing 30% of the time, you're golden, like you're pro. You do not have to be a perfect parent. Right. You just have to be really good at recognizing and accepting feedback and coaching, both from your co-parent and from your kids and from whatever other sources you can find them. And shifting and always working on being a better version of yourself. But also it's about like knowing yourself. And I know that like right now, this day and yesterday, I have not been my optimal self. And I can tell my family, like, these are not going to be my best days. You're going to have to treat me gently.
And not that you just need that treat me gently, but that it's not going to last forever. There are going to be good days.
I'll be good in like 3 days. Like give me 2 hours and I'll be back to myself.
Right. And I think that also is so important for our teenagers to understand, right? That just because you have a bad couple days doesn't mean you're going to be bad forever. Just because you are feeling like you don't want to be alive right now in the second doesn't mean you're going to feel that way 5 seconds later from now. So I think
it's much harder for their brains to understand that than it is for ours. So as parents, we really have to, I think it's helpful to talk about what you went through as a teenager, to talk to your kids about your failures and your struggles. Recommend that too.
Yeah.
Because I think saying just like, oh, you won't feel this way forever feels a bit patronizing. It's like the parent-splaining version of mansplaining, it's just like get over yourself kind of thing. But if you say like, yeah, I remember when I was in high school, we had to move and I started over and I was at the table with like all the geek kids and I didn't have any friends and like I felt like an outsider. If you can tell some kind of personal story or get them to relate to someone who went through something similar but made it through. It's like that it gets better. I love that it gets better promotion that they had for the LGBTQ kids like a few years ago. That's the message that you want to convey, but not in a kind of critical or patronizing way that you can't tolerate how your kid is feeling now, but just this idea that like, hang in there, it will get better.
And it makes me think of this acronym that I use to really help parents and people kind of meet people where they're at and think about how to frame it. So I use the phrase, the word view. So V is for validate. If our kid's having a really tough time and we're frustrated, we have to validate where they're at. Yeah, things are going to be tough sometimes. You're not going to want to put on your backpack. I is to inquire, gently investigate kind of what is happening to make you so frustrated. Is it that it's Monday, right? You identify as Monday. She's cranky, she's hungry. It's a new routine for her to set up. And then E, try to explore gently with them. Like, what is happening? What can we do to kind of make things a little bit better? What are the things around us? And encourage. How can we encourage you to do the hard thing, even if you don't want to? And finally, W, which is to kind of encourage some wonder. Like, what if it could be better? What if the Monday's not so bad? What if you make a new friend in school? And I think that to do all of that, you as a parent, we as a parent have to be in a good enough headspace to have that, right? That's the first step before all that, right? We have to kind of do what I call a parent pre-check and see how on the scale of our emotional thermometer we are, how high up we are, because we may not be able to use the view because we have no view. Our view is just to get on the elevator and get into work, right?
I'll give myself credit that before, well, of course, this all started at like 6:30 in the morning. By the time we got to the elevator, it was like 7:05. So before that, we had done the validation and I told her like, yeah, I know many days you just don't feel like going to school and Mondays are the worst. And today is really hard because it's the first Monday. And then she was like, why are Mondays so hard? So we talked about that a little bit. And then we had already done most of the in exactly that order, but I know those things, right? I'm a child psychiatrist. We had done all of that. But then when it came time to actually leave, she does what she often does. And she's getting better as she gets older, but she just kind of like gives up, throws herself on the floor, refuses, her body goes limp. She can't do anything. And I was just like, no, not having it anymore. Yeah. I was like, that's it. I've had it. So I think that's where too, like, it's okay. It's okay to recognize yourself and you don't always have to be the firm and loving or the, you can be the hostile loving parent sometimes, which is what I was this morning for a minute. But generally I try to be the firm and loving parent, but sometimes you have to be like, just pick up your damn bag. Sometimes you have that.
And I do want to point out that I think it's so important that you give yourself credit. I think we as parents do not give ourselves credits enough. We don't do it so our kids can hear us. We are more vocal about when we do a bad job than a good job. And I think that modeling is also so important because so many of these parents, I'm sure, that filled out the survey, like, again, if you're looking at the glass half empty versus half full, you're going to feel horrible. So I think we need to tell ourselves when we do a good job because we are, for the most part, doing a good enough Winnicott job.
Yes. And so often the pattern that I'm sure you see as well is that the parent feels that they're not doing a good job. They get kind of resentful of the child who's then reflecting back to them that they're not doing a good job. And then that just leads to this angry expression towards each other, that the parent's disappointed in the kid for not being what they should be or what they wanted them to be. And the kid's mad at the parent for not understanding them enough. But even in those situations, it's not hopeless. Like we've seen, and I'm sure you have too, like 180s in those relationships, and it becomes so much better once they just have some space to really explore that outside of a diagnostic label, because a diagnostic label it doesn't help anything really. I mean, it helps guide treatment, but when it comes to a relationship, it doesn't help the relationship any.
Right.
Yeah.
It's the long game. We're playing the long game as parents.
Yes, it is. This was a great conversation, I feel like.
I'm glad.
A lot of things.
I feel like I was all over the place. So
you were, but the book was kind of all over the place too. I mean, I'm looking at my notes now too. There was also this part about
I mean, we didn't really talk about meds much. I don't know if you
Oh,
want to bring that up. I feel like that's a whole other kettle of fish. But long story short, there are times that meds are helpful and times that meds are not so helpful. And you want to make sure you go to a board certified child psychiatrist to get your meds to make
yes,
sure
and
your kid's being assessed properly and treated properly.
if you don't feel like there's been enough conversation about the pros and the cons of the meds and that you've been able to explore with your treating provider alternatives to the medications, like if you haven't yet optimized sleep and nutrition and phone use and social supports and all those other things before the person is wanting to give you a medication, then you should halt and you should say thank you and you should find someone else. Because both of us, I think, agree that meds can be helpful, but they never should be the primary treatment for a problem, for a mental health problem. There's always other stuff that needs to be addressed, at least at the same time, if not before the medications. I mean, sometimes the kid's really in crisis and then you want to throw everything at them that can possibly help at the same time. But at other time, most of the time, thankfully, I think meds can be something that you get to eventually if you spend a few months trying other things that really don't seem to work.
And that if you see any doctor or medical provider and they tell you, I guarantee or I promise this will work, that is not the person for you. You cannot guarantee or promise any meds will work. You honestly also can't promise or guarantee that therapy will work.
Mm-hmm.
It is a process, this journey towards mental wellness that will unfold for our kids, for our parents, and our job as mental health care professionals is to be along for the journey and guide them in the best way possible for them. And that means there might be some twists and turns in the roads and some trials and errors. And that may mean that we stop meds or don't do meds at all. But I think it's, I also think that the comment in the book about kids and parents being so malleable, I mean, kids, I think more than adults, are much more assertive and advocate for what they need because it's very quick for them to not take meds, to not show up to you, to sit in your office and not talk to you at all. I'm sure you've had those kids too, right? They will make their wants known to you, whether they like you or whether they want to do what you're telling them to do. And so much of the art of our work is to build that trust with them so that they will finally open up and unfold and be receptive to making decisions that help them.
Yeah. Well, because ultimately, okay, here's that joke. How many psychiatrists does it take to change a light bulb? One, but the light bulb has to want to change. So if anyone can come to a psychiatrist or a therapist, but until you're ready to try something new, no matter what that person suggests, it's not going to work. And you have to try something to get into a different possible outcome, until you're willing to try something, you're stuck where you're at.
So, I will say that she makes a comment in the book about how being on a medication she had again asked psychologists for their feedback about this, not a psychiatrist. Being on a medication can prevent you from learning the skills you actually need to learn. And on the other side, if you are in a place of such mental anguish and lack of motivation and poor concentration because you are depressed, or so heightened in your state of anxiety that you can't receive information, you can't make anything out of therapy if you don't first have your emotions in a space to receive that information, think about it, and then make decisions after. Sometimes we need those meds on board to help calm and quell things so that you can actually make the most of therapy.
Yeah, if the survival brain is on high alert all the time and driving your thoughts and behaviors and actions, then your response to therapy is going to be less than if you can reduce that with a medication. Yeah, medications can be very useful. Yeah. So did she get into that nuance, or did she more say meds are bad in the book?
She didn't quite say meds are bad, but she was basically making the argument that meds can prevent youth from learning from anxiety and depression, and that anxiety and depression could actually be helpful for us. So when we use medication, that might prevent kids from gaining coping skills. That's essentially what she was saying in a variety of ways. So yes, I can see that, but again, for the kids that we are recommending meds for, typically they're not at a place where they can gain those skills, right? Like they're in need of something more to get to a place to get those skills. And again, we could spend a whole podcast series just on medication as psychiatrists. I'm being mindful of the time, but just to round out the book, I mean, I feel like if you are a parent reading this book, if you are a parent receiving mental health care for yourself or for your child, please always find out who is the person writing the book, where is the news and information coming from, who is the person that will provide that service. Do that background research for yourself. And as I encourage, and I'm sure you encourage too, you find the right path for you, right? You find the right group of people and the right people on the team for your child that can help advocate for their needs and also be in alliance and alignment with your values.
Yeah, and someone who's really going to hold you up as the primary person for your kid and not try to replace you. Because that's something that I think, again, not with any malicious intention, but I think there are therapists who can be a wedge more than they are a bridge between a child and a parent who are having trouble. And there may be cases where that's indicated in a situation where a child's really unsafe, but more often than not, if parents brought their kid to a therapist, it's because they love them and they want to mend that relationship. So, yeah. All right. Well, thank you so much for your time, Shivana. This was an awesome conversation, and I look forward to talking to you again on your podcast soon.
Thank you so much.
Take care. Bye.
Bye.